Hello my friends, my name is Dr. Saeed Kasmi and you're watching my YouTube channel. Today we will be talking about the morphological or anatomical variations of the kneecap, which is also known as patella. There are two conditions, two morphological variations of the kneecap or patella. One is a high riding patella, which is also known as Patella Alta, and the other one is a low riding patella, which is known as Patella Baja. Now in both these conditions, what happens is that the patella is not sitting in its normal place. A normal patella usually sits within the patellar groove of the femur, and it is integral to the function of the quadricep muscle group. Now, when you've got a high riding or a low riding patella, the position of the patella is abnormal, and that can give certain problems to the child. These kids usually have got problems with bending and flexion of the knee. They usually have got sort of an anterior knee pain, which sometimes become chronic knee pain without any direct trauma to the knee. They can sometimes complain of abnormal clicks in their knee joint, and sometimes they have got a bit of swelling around their knee joint as well. So it can give them different type of physical manifestations of this high riding or a low riding patella. So let's talk about these two conditions, a high riding and a low riding patella. So the first thing that we would be talking about is what we call as a high riding patella. This is also known as Patella Alta. Now, normally, how do we diagnose these conditions? A high riding patella, which is a patella which is slightly above from its normal location, is usually diagnosed when you do an x-ray of the knee joint. And when we are talking about the x-ray of the knee joint, we are talking about a lateral x-ray. A lateral x-ray usually is done in 30 degrees flexion. So what you do when you've got the x-ray in front of you, you measure what we call as Insall Salvati ratio. So Insall Salvati ratio is basically a ratio of the patellar tendon length divided by the length of the patella itself. So how do we measure these things on the x-ray? So if you look, this is a lateral view of an x-ray, and this x-ray you can see that the patella is quite high up. This is Patella Alta basically. So if we take the length of the patella itself, which is usually taken as a distance between the superior pole and the inferior pole of the patella. So the longest distance between the superior pole and the inferior pole, if we measure this distance, this would be the length of the patella. Then from the inferior pole of the patella down to where the patellar tendon inserts into the tibial tuberosity. So this is the tibial tuberosity. If you take this length, that is between the inferior pole of the patella to the point on the tibial tuberosity where the patellar tendon inserts, if you take this length, this is known as the length of the patellar tendon or patellar tendon length. Now, once you have taken this length, that is the length of the patella, and you've taken the length of the patellar tendon, you would divide the length of the patellar tendon divided by the patella length itself. A normal ratio is 0.8 to 1.2. So if you divide the patellar tendon length divided by the length of the patella, you can get any value between 0.8 and 1.2. So this is normal. If you get a value above 1.2, which simply means that the length of the patellar tendon itself is more than the length of the patella itself. That actually is diagnostic of Patella Alta, which means a high riding patella. Now remember, here we are not talking about the rupture of the patellar tendon, which can also give you high riding patella, but we are talking about the normal anatomical variations, a normal anatomical variation in which the normal uninjured patella is sitting upward. So in this particular case, the length of the the length of the patellar tendon divided by the length of the patella itself would be more than 1.2, and that is known as Patella Alta. Now, if it is a low riding patella, where the patella is sitting a bit lower than its normal position, we call it Patella Baja. Now, this is relatively rare as compared to Patella Alta. Again, we use the same Insall Salvati ratio to diagnose this thing. So here, the length of the patellar tendon is less than the length of the patella itself. For example, if you look at this x-ray, forget about these arrow markings, they are pointing towards some calcification in the quadriceps tendons. But if you take this, for example, this is the patella, and if you take the length of the patella, that is the longest distance between the superior pole and the inferior pole, and if you measure this distance and then you measure the patellar tendon length, which is the length of the patellar tendon measured from the inferior pole of the patella to the tibial tuberosity, definitely the length of patella is more than the length of the patellar tendon. So if you divide the patellar tendon length divided by the patella, you would see that the ratio is less than 0.8. So if it is less than 0.8, it means a low riding patella, which is also known as Patella Baja. And both these conditions, a high riding and a low riding patella, that can give some form of physical limitations like grinding, incomplete bending of the knee, clicking or grinding sounds in the knee joint, sometimes a bit of swelling, and chronic anterior knee pain. So if you do an X-ray in a child who has got knee pains but there is no history of trauma, you can do the Insall Salvati ratio to see if the patella is high riding or this child has got Patella Alta, or he has got a low riding or Patella Baja. So I hope you have learned something from this small lecture. Next time you have got a knee accident in front of you, I hope you can use the Insall Salvati ratio to diagnose Patella Alta and Patella Baja if that are the conditions. Have a very nice day. Take care and bye-bye.